So you know that plexus is yesterday we discussed that it's a network of nerves which come out of your spinal cord, right? So brachial plexus means that these are the plexus of nerves which are going to supply your upper limb, right? As the word brachium suggests your hand, so they would supply the muscles of your upper limb. So whenever we have damage to the different nerves, you'll be discussing that you have roots, trunks, division, and cords, and from which various nerves arises, and they are going to supply various muscles and compartments, right? So okay, can you guys tell me that you have a total of how much spinal nerve?
33.
33, right? So we have at cervical, right, thoracic, your lumbar 5, and sacral 5. Okay,
Mm.
so you can see the brachial plexus.
We can
So
see
the
the
first,
screen.
hello.
We cannot see your screen.
Okay, sorry, let me share it. Okay, so the first nerve which we'll be discussing is our axillary nerve, right? So here you can see that you have your posterior cord, and axillary nerve is going to arise from your posterior cord, right? And axillary nerve is going to supply certain muscles. So can you tell me which group of muscles are basically supplied by your axillary nerve?
Deltoid.
Okay, perfect. Deltoid. So we discussed that. Okay, can you guys tell me that what's the function of your deltoid muscle?
Abduction of
Abduction.
Abduction, right? But from the 15 degrees onward till the 15 degree, which muscle is responsible for your abduction till 15 degrees?
supraspinal.
Supraspinatus.
Perfect, supraspinatus. And if you guys remember, it's the most common muscle tendon which is going to be ruptured, right? And why? Due to its impingement between the acromion process and head
Acromion
of humerus,
process.
right?
Mm-hmm.
Yes.
And the rotator cuff muscles. So above the
Acromion
15
process.
degree till 90 degree, your deltoid muscle is going to undergo the function of abduction, right?
Mm.
Okay, so you have a U word MCQs on it. For example, if you someone have injury or dislocation of his humerus, that is anterior dislocation. So it's going to injure your humerus, right?
Mm.
Yeah, I think he accidentally left the meeting.
Yes. Maybe some network issue is there.
Could be.
Maybe you didn't give Lamborghini. That's why he is angry.
Hello, what
Yeah.
happened?
Hi.
Why are you guys laughing? Okay, just tell me the joke. Why are you guys laughing? I would be thinking in the whole lecture that why are you guys laughing? What happened? Okay, so we okay, so axillary nerve is going to be damaged whenever we have anterior dislocation of your humerus bone, right? This is also one of your U word MCQs, right? Anterior displacement. Remember, anterior.
Yes.
Okay. Then we will be discussing another nerve that here you guys can see your radial nerve, right? Radial nerve also arises from the posterior cord. And you guys know radial nerve is going to supply all of your extensor muscles, right? Okay, on the back of your arm, for example, this is your arm, your forearm, and your hand, right? So on the back, you have tricep muscle, right?
Mm-hmm.
Okay, what's the function of tricep muscle?
Extension.
Extension of
Okay,
elbow.
it's going to extend your forearm, right? Okay. On the back of your forearms, you have extensors, muscles as well, which are going to extend your wrist.
Mm-hmm.
Yes.
They
Yeah,
are also supplied by your radial nerve, right?
right.
And on the dorsum of your hand, the sensory supply, for example, this is the dorsum of your hand. Okay, let me draw the hand. Okay, three, four. Okay, lateral side one, two, three, four, and five. Right. So here, okay, this part is going to be supplied. The sensory innervation is going to be supplied by which nerve? Yes, half
ulnar.
of the yes ulnar, and this is basically a dorsum. It's going to be supplied by radial nerve, right?
Mhm.
Okay. So for example, if we have any lesion to the radial nerve, it means extension would lose. So we'll be seeing a condition. What's the name of that?
Glow hunt?
Wrist
Okay,
drop.
it's wrist drop,
Mm.
right?
Yes.
Okay, claw hand will be discussing it whenever we have lesion to the median and ulnar nerve. Okay, so it means that radial nerve is going to supply extensor muscle to your arm, that is wrist and fingers as well. Okay, to the tricep, which also extend at the elbow, right? And what's the other function? It supinate your arm, forearm, right? Supination. You have pronation and supination. Like for example, if you are facing your hand like that, it's pronation, and if you are just flipping it, so it's supination, right? Okay.
Yes.
So okay, so for example, this is your okay. This was the dorsum of your hand. Let's suppose this is the anterior part of your hand. Let's suppose, okay. One, two, three, four, five. Okay, just sorry for this hand. So, okay, towards the thumb side, okay, these muscles are going to be supplied by which nerve? Yes,
Median nerve.
median
Median?
nerve.
Median nerve.
Again.
Yes, and okay, median nerve in one, two, three, half of this sensory is also supplied by.
Ulnar.
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 Ulnar
Okay,
nerve.
this is your ulnar nerve. Okay, and the muscles, okay, these are basically known as thenar muscles, right? And your hypothenar muscles. So hypothenar muscles are supplied by your ulnar nerve, right?
Mhm.
Okay, you also have certain muscles in between your, okay, for example, this is your hand, right? So in between these bones, metacarpal bones, you have muscles that are basically known as interossei muscle, right?
Interosseous. Mhm.
Yes.
So you have interossei muscles on the front and on the back. And what's the
Mm.
fun? Okay, which nerve are going to supply all of your interossei muscles?
Ulnar.
Ulnar.
Ulnar nerve. Perfect. So you have anterior interossei muscle and posterior side interossei muscle. And
Mhm.
what's the function of anterior or on the palm side of the interossei muscle? Which action is going? Are they going to perform?
Action.
Okay, it's going to adduct. And on the back of the hand, the interossei muscles are going to abduct, right?
Abduct.
Abduction.
Okay, perfect. Okay, another thing. For example, we will be discussing it in detail, but here let's cover it, right? Okay, sorry for this hand. Okay, whatever. Okay, okay, this is your thumb, right? Okay, one, two, three, four, and five. Okay, so you have lumbrical muscles,
Yes.
lumbricals, and lumbrical muscles are basically originated from the tendon of the flexor profundus muscle, right? So you have extrinsic muscle in your forearm that is known as flexor uh, profundus muscle, right?
Like
So
the
basically the
vertebrae.
lumbricals arises from the tendons of these profundus muscles. So you have four lumbricals, right?
Mm.
Mm.
One, two, three, and four. Okay, what's the function of these lumbricals? Yes.
L shaped.
Yeah. So
Okay,
it is like
L
flexion at
shape.
the MCP. Yeah.
Yes. So
And
flexion at MCP and extension at
IP joints.
VIP.
interphalangeal.
Mid.
Okay. So
Interval.
the lateral one, the lateral two lumbricals are going to be supplied by your median
Median.
nerve, right?
Mm.
And the medial two are going to be supplied by your
Ulnar.
Ulnar.
ulnar nerve. So we'll be discussing in the details, but here we were discussing the um, radial nerve, right? So, for example, if someone have injury to the radial nerve, so you are going to see weakening of your tricep, right? Triceps is going to become weakened. Secondly, you will be seeing wrist drop. Why? Because all of the extensor become weakened, so the flexors dominate, right? So that
Yes.
whenever the flexor dominate, it would like drop your wrist. You are going to see wrist drop like that, okay? Hanging
Mm.
of the wrist. And you are going to see sensation lost on the dorsum this side, right?
Dorsal.
These three
Three
and a
and a
half.
half.
Okay. So, what are some of the causes of the radial nerve? Yes, like it can happen uh, in the humerus side. Okay, and if you guys remember, for example, this is your humerus. So you're on the shaft. You have a groove that is basically known as radial groove. So the radial like nerve basically passes through the radial groove. So you can have damage somewhere here. For example, if we have fracture of the shaft of humerus and up in the axilla, like here as well. So for example, if you have lesion somewhere here, it means that all of the function beyond this nerve are going to be affected. That is, you are going to see weakening of your tricep muscles as well as you are going to see weakening of your extensor muscles. But if we have fracture of the shaft at this groove, you are also going to see an MCQ related to it. So what happens, basically your tricep is spared. Okay, so you have no like uh, weakness of tricep muscle whenever you have injury at
Make
the
sure.
shaft, right? Okay, so okay, so tricep is going to be spared. Okay, then you have another nerve that is musculocutaneous nerve. Here you can see. Okay, it's cutaneous now. Okay, this is your musculocutaneous nerve. So musculocutaneous nerve is going to supply your biceps, right? And along with that it have a sensory root as well. Okay, here you guys can see the radial nerve. Here this is the groove in which radial nerve is present. It's going to supply all of the extensor muscles. Okay, here, so this is your wrist drop. All of the extensors, for example, um, aren't working, so the flexors would dominate and it would result in wrist drop like that. Okay, so then we have the musculocutaneous. Here you can see the shaft, your radial sulcus. Here your radial nerve basically runs. Okay, so this is the posterior view. So these parts are basically the dorsum one third. This is basically going to be supplied by your radial, right? Okay. So now let's discuss biceps muscle. Your musculocutaneous is going to supply your bicep muscle. As the name indicates, you also have a cutaneous branch. So can you guys tell me that musculocutaneous is going to supply which part of your forearm? Sensory supply. I'm discussing about sensory.
Lateral forearm.
Lateral side, right? This. Okay. So, for example, if someone have if someone have damage to the cutaneous nerve, so what happens? You are going to see weakness of bicep muscles, right? As well as the lateral side sensation are also going to be lost. Okay. So these were the uh, nerves which are going to supply your arm as well as forearm. So, Dr. El Future, can you just give us a quick overview on these nerves? Here I have just compiled all of these. Okay. 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 Yes. Yes. Okay. So now that okay. 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 Yes. Okay. Which muscles, which group of muscles are going to be supplied by your ulnar nerve? Yes. Okay. The interosseous muscles. Perfect. The lateral, the medial two lumbricals. Okay, and it also supplies the hypothenar muscles, right? Okay, okay, okay. So can you just tell me the sensory supply of ulnar nerve? Okay, the sensory supply. Okay, on the palm side, it's going to supply your. Okay, let me just show you here. For example, this is your palm side. It's going to supply this part.
One and
It's
a
one
half.
and a half. Okay, this is a little. Yes, but half of the ring finger, right? And on the dorsum as well, it's going to supply this little and half finger, right? So, and this supply this. Okay, just tell me about median nerve, please. Okay, and what's the motor supply of the median nerve?
Tendon
Median nerve,
muscles.
thenar muscles,
Thenar
Female
right?
muscle.
members.
Thenar muscles, lateral to lumbricals.
Mm. Yes.
Yes. So now let's discuss the damage to the trunk. For example, we can have damage to the upper trunk and damage to the lower trunk, right? So for example, if someone have damage to the upper trunk, so you are going to see axillary nerve being involved, right? Your musculocutaneous nerve is going to be involved, and along with that, your suprascapular nerve is going to be involved, right? So the upper trunk. So can you guys tell me that in which condition are we going to see the upper trunk lesions or the injury to the upper trunk?
Shoulder dystocia.
Perfect. So in the birth trauma, if you are increasing the angle between shoulder and your neck, so it means it can easily rupture your upper trunk. And if upper trunk is damaged, so you are going to see axillary, musculocutaneous, and suprascapular nerve involvement. So we already know that musculoskeleton. Okay, okay, the musculocutaneous nerve is going to supply your bicep, right?
Mm-hmm.
And bicep flexes. So if this function is lost, so what happens? You are going to see extended arm, right? Okay, axillary basically it supply the deltoid and it abducts. So abduction loss, it means your hand will move towards your body. It would be adducted, right?
Mm-hmm.
Okay, your
Mm-hmm.
suprascapular nerve basically supply your, yes,
Internal.
inferior and,
Infraspinal.
yes, infraspinatus and supra, which basically undergo the external rotation. So it means external rotation is lost. So your arm would be internally rotated. So
Mm.
like
Mm-hmm.
combined, these three effects are going to give you certain characteristics. That is known as Earth's palsy or waiter tip sign, right?
Mm-hmm.
Okay, so it's basically waiter tip. Like for example, this child would be having the arm close to his body because he lost abduction. Arm would be adducted, that and internally rotated, right, and extended due to loss of your of bicep. Okay, so now let's discuss another. For example, if someone have damage to the lower trunk, can you guys tell me in which condition we are going to see lower trunk injuries? Okay, if you are excessively abducting your arm, right? For example, if someone is falling off a tree and he just catch the tree branch, it means he's overextending or over abducting his arm. So it can damage your lower trunk. And whenever we have damage to the lower trunk, yes, we are going to see two nerves involvement. That is your ulnar and median nerve is going to be affected most, right? So if we have ulnar nerve affected, it means that what happens? Yes, interossei gone, right?
Mm-hmm.
Okay, another thing, your, okay, if we have ulnar and median both involvement, right? So it means the lumbricals
Will be
are
gone.
also gone, right?
Uh-huh.
So if the lumbricals are gone, so it means what would happen to your hand? Lumbricals were just forming that L shape. So now what will happen? You are going to see straight fingers with the with flex interphalangeal joints. So
Hmm.
something like that. So it basically gives you claw hand, right? You're going to see claw hand formation. Here you guys can see if you have ulnar and medial nerve uh, destroyed, so it means that you're going what the lumbricals are also gone, right? So for the lumbricals basically flexes these joints, right, and extended these. So it would be reverse. You are going to see extension of these and flexion of interphalangeal, like it would be just forming a claw. So you are going to see claw hand, right? Whenever you have lower trunk injury and both median and ulnar nerves are involved, right?
Hmm.
Yes.
Okay. So then we have a condition that is known as thoracic outlet syndrome. So first of all, you guys must know that in the thoracic outlet syndrome, okay, what is thoracic outlet by the way? Above the first rib, above the first rib, and behind the clavicle, right? Here. So if we have any pathologies related to this thoracic outlet, for example, one of the most common is cervical spine, right?
Mm-hmm.
Cervical rib. So it can impinge upon these structures, the arteries and nerves, and it can give you outcomes of thoracic outlet syndrome. So the other thing you must know here, you guys can see that basically they you have two muscles that are known as, okay, you have scalene muscles. You have
Hmm.
anterior scalene, middle scalene muscle. This is your anterior scalene muscles and your median scalene muscles, right? So these plexus come out in between them, right?
Mm-hmm.
This is also one of your U-word MCQ. They are going to ask you that um, the nerves are going to come out in the thoracic cavity between which two muscles. So they are anterior and middle scalene muscles, right?
Hmm.
Okay. So for example, if someone have that cervical rib, that extra small rib, so it can compress upon these nerves, right? And as a result of that, it can like it can just damage the brachial plexus, right?
Hmm.
And which plexus are going to be affected? The lower plexus, right?
Mm-hmm.
Okay, in thoracic outlet syndrome, like here you can see that extra spine coming out, right? So it can basically affect the nerve, the brachial plexus, which are coming out between the two muscles that are anterior and middle scalene here, anterior and middle scalene. And
Hmm.
mostly it's going to give you the lower trunk involvement, right? So you are going to see,
Clawing up.
yes, okay, claw
Clawing
hand,
up.
right?
Claw hand.
Hmm.
And along with that, you can also see compression, venous compression. For example, if I'm compressing the veins, so it's going to give me the ischemic pain, right? There would be difference in the systole and diastole if I'm compressing some arteries here, right?
Hmm.
Okay. So lastly, we'll be discussing another nerve. Okay, let me just come here. That is long thoracic nerve, right? Which basically comes out from your C5, C6, and C7. So long thoracic nerve basically supply your, yes,
Serratus anterior.
That is anterior.
serratus anterior, right?
Mm-hmm.
This is also one of your U-word MCQs. And what's the function of serratus anterior? It's going to keep your scapula close to your ribs,
Thorax.
right?
Mm.
So, for example, if we have loss of this nerve, right?
Hmm.
So, what happens? The serratus anterior muscle would not function well, and as a result of that, so basically we just tell the patient to outstretch his arm and press against the wall if his serratus anterior muscle isn't working well. So the scapula is going to move away from the rib cage, and this is basically known as winging of the scapula, right? You also have an MCQs on it, you word MCQ, right? They are going to tell you that we just ordered a patient to on a to like push the wall with an outstretched hand, and as a result of that, his scapula just come outward from his rib cage. So, what do you think? Which muscles is and which the function of which muscle is impaired? So that is basically your serratus anterior, right? So,
Hmm.
Dr. Renu, can you just give us a quick overview
Mm-hmm. Mm,
right from the biceps?
okay, so The biceps, they are supplied by the musculocutaneous nerve,
Okay,
and they help in like the flexion of the arm.
perfect. And what's
Yeah.
the sensory supply?
Sensory supply of the musculocutaneous is like towards the lateral side of the forearm.
Okay, perfect.
Yeah.
Okay, now let's discuss lesion of the trunk. You have upper trunk and lower trunk. For example,
Mm,
if someone have upper trunk lesion, can you just tell me the most common condition in which the upper trunk is going to be
yeah,
damaged?
during
And
like
just tell me the
trauma.
associated nerve. Okay.
Yeah, so it is like trauma during childbirth when there is
Okay.
like gap between the neck and the shoulder.
Okay.
So the nerves injured is like deltoid is will be injured.
Yeah, like axillary nerve is injured. It means
Sorry,
the supply
yes,
to deltoid will
yeah,
be impaired.
impaired.
Secondly,
Secondly, the suprascapular nerve will be injured.
okay, suprascapular nerve is damaged, so it means
Hmm.
now you cannot externally rotate the arm.
So the
The
arms will be
infraspinatus
internally.
and
Hmm.
yes. Okay, and thirdly,
And thirdly, I'm forgetting.
okay,
Musculocutaneous.
thirdly, musculocutaneous.
Musculocutaneous. Yeah. So the flexion will
Yes.
be lost. So the arm will be extended.
Okay, collectively, all of these three things are going to give you a characteristic.
Waiters.
Yes, that is Wetter
Waiters.
steps, right?
Hmm. Hmm.
Okay. So, can you tell me, okay, if you have damage to the lower trunk, then you are going to see damage of which nerves, and as a result of that, what would happen?
Yeah, so lower trunk, both the median nerve and the ulnar nerve will be damaged,
Okay.
and the deformity will be like the claw hand because
Okay.
like
Why?
the lumbricals, the ulnar nerve, sorry, mm, the lateral side,
The lateral
median
side two lumbricals are
median nerve,
supplied by your median, and the
median
medial two
median
lumbricals
side
are supplied by yes.
ulnar nerve. So that function is lost, and there will be like claw hand position.
Yes, claw hand. Okay.
Mhm.
So, okay, can you just tell us about thoracic outlet syndrome?
Okay, so thoracic outlet is like a little space between the
Yes.
first rib and behind the clavicle.
Behind the clavicle, yes.
Yeah, so sometimes when you have an extra rib, so that thoracic outlet get compressed between the scalene muscles, the
Yes, the
anterior.
nerves can be compressed. So, which trunk? Okay, upper trunk is going to be affected more or lower trunk?
Lower trunk.
Okay, lower trunk. Okay, can you just tell us about what is winging of scapula? What's the nervous supply of serratus anterior? And what's the
Yeah,
function?
so winging of scapula is seen in like long thoracic nerve damage. So long thoracic nerve supplies the serratus anterior, and the function of the serratus anterior is to like pull the muscles and the scapula towards the thorax.
Okay.
So if that function is lost, then the scapula is like bulging outwards.
Okay.
If you ask the
Perfect.
patient to apply resistance against the wall.
Okay, perfect.
Mm.
So now let's discuss the wrist, right? So you have different bones in the wrist. That is, you have total of eight bones, right? Okay, and these are basically known as your carpal bones, right?
Uh-huh.
Carpal. So you have the four that are proximal and four distals. So A is basically your scaphoid, right? B your lunate, T your triquetrum, and D your pisiform bone, right? Okay, so we'll be discussing the high yield things. Okay, can you just tell me the most common injured bone
Scaphoid.
in the scaphoid? Perfect, scaphoid. Okay, and scaphoid basically sits. Okay, this is one of your U word MCQ, right? Another MCQ, scaphoid basically sits at the base of the anatomical snuff box,
Snuff
right?
box. Yes.
Okay, which kind of injury is going to damage your scaphoid bone?
Avascular necrosis.
Yes, a vascular necrosis can damage your
For
scaphoid
and
bone.
like fall on outstretched.
Outstretched hand,
Yeah.
perfect. That is fall on outstretched hand.
Distal
Okay.
radial dislocation.
Sorry.
Distal radial dislocation.
Yes, distal radial. For example, if distal radial is dislocated, so you know they are in contact with the radius bone, so you can have damage to the scaphoid bone, right? Okay. So the second most common injured bone is your
Lunate.
Hamate.
lunate bone. Okay, perfect. So lunate bone, and an important point which you guys must remember that whenever you have damage to the lunate bone, so lunate as it sits above the radius, so this bone is pushed forward. Normally the bones come backward, right, to the posterior side. Whenever you have damage to the carpal bones, but this lunate bone is going to be pushed forward, right? And another point, you are going to see damage on the waist of this bone, right? The scaphoid bone have a waist here. Okay, let me show you. Here you guys can see this is the waist. You can see damage. This is your scaphoid, right? This is your lunate. Okay, another thing. Lunate basically sits upon the, yes,
Radius.
okay, it sits upon the radius, but here you have the carpal tunnel.
Carpal tunnel.
So whenever we have anterior dislocation of lunate bone, it can compress the carpal tunnel.
Yes.
And inside the carpal tunnel, you have a nerve going. What's the name of that?
Median nerve.
Median nerve.
Perfect. So median nerve runs inside the carpal tunnel, and whenever we have the lunate anterior dislocation, so it can, yes, impinge
Compress.
upon the
Median nerve.
median nerve, right? So you will be seeing median nerve. Uh, okay. So here you guys can see, okay, the compressed nerve. Okay. Okay. So now let's discuss carpal tunnel syndrome. So what's carpal tunnel syndrome? Yes. Hello.
Of the median nerve.
Median nerve dysfunction.
Okay, whenever we have compression of the carpal tunnel, and as a result of that, you are impinging upon the median nerve. So this is basically known as the carpal tunnel syndrome. So can you just tell me the conditions in which the carpal tunnel syndrome normally happens? Okay, if someone have acromegaly, right, big hands, so it can, okay, you have a band of fibrous tissues present on the surface that are basically known as, yes, flexor retinaculum, right?
Yes.
Okay, so flexor retinaculum. If you have big hands in case of acromegaly, so it can again compress the carpal tunnel, right? Okay, just let me show you here the carpal tunnel. Okay, this is your carpal tunnel, right? This is your flexor retinaculum. This is your median nerve. Okay, here you guys can see the bones. Okay, so whenever, for example, if a person is having an acromegaly, so it can compress upon this, it can just narrow this tunnel, and as a result of that, you are going to see impingement of the median nerve. Okay, whenever we have impingement of the median nerve, again, can you just tell me what would happen to the hand, which muscles lost? Yes, pinnar muscles, right?
Pinnar muscles.
Okay,
The lateral
lateral
umbilicus.
lateral two lumbricals. Okay, and sensory
Sensory innervation to the 3.5
three and a half lateral
palmar
fingers,
side.
right? Okay. So, okay, we discussed the condition. If you guys remember that we have MSC1 complex, and on the receptor you have beta 2 globulin. So, those who are on dialysis can have amyloidosis of beta 2, right? Okay, this beta 2 accumulation in case of dialysis, it can also cause carpal tunnel syndrome. Right? For example, if they are deposited here in the carpal tunnel, so it can closes the carpal tunnel, and as a result of that, you will be seeing carpal tunnel syndrome, right? So, another thing which you guys should know here, you have a carpal tunnel for your median nerve. This is your flexor retinaculum, but on the up, like just above this flexor retinaculum, you also have another tunnel that is known as Guyon tunnel, right? So, in the Guyon tunnel, basically your ulnar nerve, right? So, for example, if someone have compression of this ulnar nerve, so what would happen? Yes.
Hypothenar muscles.
Okay, hypothenar muscles.
Then the medial side lumbricals.
Okay, medial two lumbricals.
Yeah.
interossei,
Interosseous.
and
Yeah.
one
Sensory
and a
septum.
half,
One and a half
one and a
sensory.
half. Okay,
Hmm.
one plus one and a half on the palm side, and one and a
Dorsum.
half on the dorsum side, right?
Hmm.
Okay, perfect. So basically, the okay, so you are going to see laws of abduction and adduction both, right? And sensory loss on that side. So, how does the Guinan canal syndrome like take place? So, it basically those who are bicyclists, right? They are prone to have Guinan tunnel syndrome, right? And compression of their
Mm-hmm.
ulnar nerve, because it's like uh, assume that overuse of the wrist can cause Guinan tunnel syndrome.
Mm-hmm.
Okay, someone doctoral futures your okay. So then let's discuss an injury that basically happens in the uh, pediatric fractures. So, okay, what happens in pediatric fracture? There is an injury which is known as green stick fracture. So, what do we mean by green stick fracture? Like, green stick fracture can. Okay, can you just tell me what is green stick fracture? Yes, the bone doesn't break completely, but you are going to see bending of this bone, right?
Mm-hmm.
Because like in children, the bone is mostly made up of the cartilages, right? So
Mm-hmm.
you're going to see bending of the bones. So this was all about the okay. So you have okay. Just give me a second. This is okay. Okay. So now let's discuss hand. Okay. So hand. Let's discuss the here. You can see you have your carpal bones, your metacarpal bones, which attaches your phalanges to your carpal bones, right? The metacarpal in between the carpals, right? Then you have your phalanges, that is three phalanges in each finger, but two in the thumb,
Thumb. Mm-hmm.
right? Okay, so we have already discussed ulnar and median nerve. Here we are going to have a quick overview, right? So ulnar nerve is going to supply, yes, anyone. Okay, you have two muscles inside your hand. One are known as intrinsic muscles and other are known as extrinsic muscles. So can you tell me what are intrinsic muscles?
Interossei and lumbricals and the
Okay,
thin.
perfect. So your interossei, your lumbricals, thenar and hypothenar, those muscles which are present in your hand. And your extrinsic muscles that are present outside your hand in the forearm, right? So
Okay.
can you just give me an example of one of extrinsic muscle?
Flexor muscles and the extensor muscles.
Sorry.
The flexor muscles and the extensor muscles.
Yes, flexor and extensor muscles in the forearm. Okay, so in the intrinsic muscles, you have hypothenar muscles, your thenar muscles, right?
Mm-hmm.
Your interossei, already discussed, and your lumbricals. So you have three muscles, the thenar muscles. Okay, you have three thenar muscles that are, yes, abductor,
Policies.
pollicis for your thumb, right? Brevis,
Mm-hmm.
flexor, pollicis, brevis, and opponents,
Mm-hmm.
pollicis. So flexor are going to flex your thumb, right?
Hmm.
Mm-hmm.
Okay, the abductor are going to abduct your thumb, and the opponents. Okay, what's the opposition movement? Here you can see that, for example, if someone is counting his finger with the thumb, so this is
Hmm.
opposition movement, right? So
Mm-hmm.
Hmm.
the opponent policies is going to undergo the which movement? Opposition movement, right?
Mm-hmm.
So, okay, these three nerve muscles are basically supplied by your median nerve. We have already discussed that, right?
Right.
Okay. So, for example, okay, then you have your hypothenar muscles, right? Hypothenar muscles are present to the medial sides, the digiti minimi, right?
Mm-hmm.
Towards the small finger. So again, you have opponent, digiti minimi, you have your flexor, digiti minimi, and you have your abductor,
Abductor digital.
digit in English, right? And they are going to be supplied by your, yes, which nerve?
Ulnar.
Ulnar.
Ulnar nerve, right? Okay, then you have your interosseous muscles. Here you can see the interosseous muscles. So between interosseous, between the bones, right?
Mm.
Okay, so you have two groups, one on the anterior side and one on the palmar, on one on the dorsal side, right? So all of these muscles are going to be supplied by your ulnar nerve.
Ulnar.
The dorsal muscles are going to, yes, abduct,
AB duct.
and the or on the palm they are going to palm
AD.
side
Adduct.
adduct, right? Okay,
Adduction.
then you have your lumbricals. Here you guys can see your lumbricals. Okay, so important point which we have already discussed, that lumbricals do not initiate from the bone or originate from the bone. They are going to originate from the from the
FD
tendons
tendon.
of flexor digitorum profundus. From the tendons of flexor digitorum profundus, which is an extrinsic muscle, right, inside your forearm, which is going to flex your, yes, fingers, like flexor digitorum, flexing your digits, right? And it's an extrinsic muscle. Right. Okay, so what's the function of the lumbricals? It's going to form that L shape. So it means it's going to flex your metacarpophalangeal joints and it's going to extend your interphalangeal joints, right? Okay. So then you have your lateral two and medial two. So the medial two are basically going to be supplied by your ulnar,
Ulnar.
and the lateral two are going to be supplied by your
Med-
median nerve. Perfect. So, for example, if we have loss of the lumbricals, as we discussed, all lumbricals, it's going to give you claw hand, right?
Mm.
Okay. So then let's discuss the extrinsic hand muscles. So extrinsic hand muscles, as we have already discussed, that they are present outside your hand, that is in the forearm, and one of the muscle that is flexor digitorum profundus, right? They are going to flex the digits. For example, if someone is making a fist, so this making of fist is basically done by your flexor digitorum profundus, right? Okay, so flexor digitorum profundus as well, they are going to be innervated by the two nerves, right? On the lateral, tendons are going to be innervated by, it's
Medial.
same as that of the lumbricals, median nerve.
Mm.
And the medial side tendons are going to be innervated by your ulnar nerve, right?
Mhm.
Like you can simply relate it with the lumbricals, as lumbricals are going to arise from the tendons of these this muscle, right? So it means they have the common nervous supply simply. Okay,
Mm.
so extrinsic hand muscles, okay, at the back of your arm, you have, okay, so on the back of your arm, your extrinsic muscles, that are extrinsic digitorum, right? Extensor digitorum on the back. On the back, you have extensor, right?
Yes.
Mm.
And they are going to be supplied by which nerve?
Radial.
Radial nerve. Perfect. Okay, so we have already discussed that we have, okay, mm, okay, for example, if we have loss of the radial nerve, you are going to see
Wrist drop.
rest drop. Perfect. So, I mean, anyone who can just give a quick overview on the median nerve and the nerves or the muscles which they are supplying, and the ulnar nerve and radial nerve. Just be quick, guys.
So I will do it.
Yes, thank you.
So the median nerve supplies the flexor muscles, uh, and it passes through the flexor retinaculum, and it supplies the thenar muscles, the
Okay.
lateral two lumbricals, and
Okay.
sensory supply on the lateral 3.5 fingers, anterior
Okay.
side.
Perfect.
And the ulnar nerve supplies the flexor muscles on the medial side, and it passes through the Gaian canal, and it supplies the hypothenar muscles, the medial two lumbricals, and the both palmar and the dorsal interosseous, and
Okay. Perfect.
sensory supply on the medial 1.5 fingers, both anterior and the posterior side.
Okay.
And the radial nerve supplies the extensor compartment of extensor muscles, and it supplies the
Okay.
extensor.
Okay. Let me add another thing. For example, if someone have median nerve lesion, it means you're going to see, yes, loss of abduction, flexion, right? Flexion of the thumb, abduction, flexion, and opposition. So it means
Mm,
your thumb would be adducted, right? Okay,
mm,
let me just show you here. Give me a second. It means your thumb would be adducted, right? And
mm,
other thing, for example, if you are losing the function of the lateral two lumbricals, so you are going to see claw, okay,
mm,
claw, lateral two fingers, right? Like these joints are going to be flexed and these are going to be extended, right?
mm,
If I'm telling these patients to just make a fist,
Mm-hmm.
so
mm,
these two fingers are working, right? That would just he would just
mm,
flex these two fingers, but he cannot flex them, right,
mm,
at this joint because you have loss of the lumbricals. So what's this sign? This is Pope's blessing, right, or hand
mm,
of benediction. So that
Mm-hmm.
would just form hand of benediction, right? And here
Median
you
nerve.
get, oh yes. So here you guys can see, for example, in the resting phase, again he'll be having extension of this joint. These two, I'm talking about median nerve only, right?
Mm.
mm,
Okay, flexion of this, and you have the hypothenar. You can see the thenar muscles atrophy. You aren't seeing that bulge, which
Mm.
mm,
normally the thenar muscles form, right?
Mm.
mm.
Okay. So, for example, if we have, okay, how can the median nerve get damaged? One, we already discussed. For
Uh,
example, if you have laceration, right, right, laceration to this nerve. Secondly, for example, if we have the, we have discussed that if you are compressing a long-term compression of the, yes, carpal tunnel. For
mhm,
example, if carpal tunnel syndrome is for long term, so it can just
Mm.
damage your median nerve, and as a result of that, you will be seeing these signs,
mm,
right? And another thing, if you guys remember, for example, this is your humerus. So median nerve basically go anterior to the humerus. So for example, if someone have fracture to the condyles here, right? So it can damage your median nerve, right?
mm,
As a result of that, you will be seeing, yes, outcomes of the median nerve. Okay, you know the ulna is present somewhere. This is your ulna and this is your radius, right? Like medially you have ulna. So the ulnar nerve basically go on the ulnar side. So for example, if you have fracture to the ulnar side of the humerus, so it can damage your ulnar nerve, right?
Mhm.
And secondly, the Guyon tunnel.
mm,
Like you can have damage at two locations. First at the carpal tunnel location, and secondly you can have upper whenever your condyles are damaged. So you are going to see an MCQs on this.
Mhm.
Okay. So yes, please carry on, Dr. Ramesh.
mm. Okay, if there is like a lesion for the median nerve, then all the lateral two lumbricals will be gone. So there will be clawing of the two fingers, and the abduction of the thumb will be lost. So it will be like adducted. And so
Okay,
if I
perfect.
tell this patient to make a fist, the medial two fingers will claw, but the lateral the thumb and the lateral two fingers will not, and this sign will be called Pope's blessing sign.
Yes.
And in resting state, it will it will be called ape sign, as per I know.
Yes, it's ape sign, right? Okay. So, for example, if we have damage to the ulnar nerve, yes.
Mm. So if there is a damage to the ulnar nerve, then the medial two lumbricals will be lost,
Mm.
and for
Okay.
that,
So if the medial two lumbrical loss, it means you are going to see extension on this and flexion on this. So normally, if you just tell these patients to put their arms, so it would be like in this way, right?
Mm.
mm,
And you are going to see the hypothenar atrophy, right? upper limb, and tomorrow. Okay, have you guys? Are you guys done with your assessment? Hello, hello.
No, sir.
Are you guys done with your assessment? Have you guys completed your?
No, sir. For me.
Okay. So we are going to start the neurology day after tomorrow. Tomorrow we'll be doing the pathology section. Like we are almost done with the upper and lower limb. So tomorrow we'll be finishing off the pathology section. And today was your last day for MSK, right?
Yes.
Hello. Okay. So I'll be sharing the task for the next week. That is our let's do the pathology portion. And day after tomorrow I'll be starting neurology.
Neurology will be started from tomorrow, like task.
Okay, I'll just share task today. You can just have your
Yes, please.
tomorrow's task. But tomorrow in the discussion session, we'll be discussing the pathology section of MSK. Then you have 7 days for your neuro, right? And we'll be completing the neuro within 7 days, right? Okay, I'll be sharing the task right just after the class.